apologies. I would just like to let you all know that the session is going to be recorded and will be included in the wrap-up email that we send out in about a week regarding this brown bag. So let us know if you don't consent to being recorded. The other thing I wanted to let you all know is that questions will be taken towards the end of the presentation. And with that, I would like to hand over to Jill. Thank you.
Thanks, Katusha, and good afternoon, everybody. And yeah, I'd just like to echo Katusha's warm welcome as well. Oops. So this was the report that we worked on for the World Economic Forum. It's titled Inclusive Health Systems Innovations Towards Health Equity in Africa. And this was presented at one of the satellite sessions of the World Economic Conference that they had in Davos in January earlier this year. The report, we do have a link to it, and our colleague Evie will drop it in the chat so that people can download the report and read it further. So this report was namely to examine the barriers and solutions that social entrepreneurs and innovators in health experienced while they are working towards equitable and inclusive health systems. We all know that COVID-19 exposed the fault lines in healthcare systems around the world, but social innovators and entrepreneurs were resilient, and some of them even thrived during the period. We also saw the role of different actors in the ecosystem, such as corporates, investors, public sector, and private sector individuals and organizations, and how they all contributed to creating enabling environments for social entrepreneurs and innovators to thrive. So this report was funded by the Schwab Foundation for Social Entrepreneurship and the Bayer Foundation. And our partners who we work together with was Impact Intelligence, who are experts in artificial intelligence tools, and Impact Hub with their various branches throughout Africa. So the piece that Impact Intelligence did with the artificial intelligence data-driven approach was to do a full scan of the web. This included different content pieces like your articles, your journal publications, videos, webinars, social media posts, like everything across the board. And then they looked at different countries in Africa and also across the various languages that we get on the continent. They then developed heat maps where there were different themes that emerged and where content was created. And from that, they broke it out into qualitative themes. So they identified the barriers and solutions that came up throughout their search. And at first we had about 1.9 million hits, and then they narrowed it down and distilled it to about 450,000 items, which we used in the analysis of the report. Our piece consisted of 35 semi-structured interviews with health experts, international organizations, social innovators, and entrepreneurs, NGOs, people from academia, even representatives from the WHO Africa Regional Office. One of the struggles that we had was getting public sector and namely Ministry of Health officials there. I think maybe they were a bit too busy during the time when we were scheduling interviews. We also had 3 consultation workshops with stakeholders and partners. This was kicked off with the 2022 SANCALP Africa Summit. We just had an introductory discussion to get our thoughts on track. And then in the tail end of last year, towards October and November, we had 20 validation workshops with participants, namely to see, do the AI findings translate to what they were seeing on the ground? So one was held in Accra, Ghana, and the other one was in Harare, Zimbabwe. So moving on to the barriers that we identified. The lion's share came from weak healthcare capacity and infrastructure across the continent. We know the problems that plague our healthcare system well, and I think it wasn't surprising to see that. This was closely followed by a lack of access and affordability to quality healthcare and medicine. And within the COVID period, we also saw that inequity related to COVID-19 and the economic impact of COVID-19 also emerged as barriers to inclusive health systems. Lesser barriers are in supply chain disruptions and logistics, digitalization and inaccessibility of data. So that relates to technological advances in health systems. And we saw there were big gaps in stigmatization and gender inequality, which prevented the creation of inclusive health systems. So those are the barriers. And now moving on to the solutions. So here towards the bottom quadrant, bottom and upper quadrants there, we can see transport and storage of equipment. That again relates to logistics and distribution, as well as diagnostic technologies and telemedicine. That's where your technology and data innovations came up. And these were the popular solutions that emerged across the continent. Solutions that were not as popular were in support systems for entrepreneurs, knowledge and awareness building, agri-tech and payment solutions for farmers, and the management and recycling of waste for medical purposes. So those areas of solutions require a lot more support going forward. The different countries that we analyzed, we decided to put them onto a sort of spectrum as to whether they had a public sector enabling environment or private sector enabling environment. So public sector enabling environments refers to policies, regulations, laws that foster the growth of social entrepreneurship, whereas private sector enablers are incubators, accelerators, funders who constantly drive these. So we can see countries like Nigeria, Ghana, and Kenya have a strong public sector enabling environment, and South Africa leans more towards the private sector enabling environment. What is ideal is to be kind of in the middle there. That's the sweet spot that you're looking for. And we can see Rwanda is positioned quite perfectly and having a balance between the two. So solutions versus enabling environments. So we found that if you have a very strong enabling environment, you are likely to get proven and scalable solutions happening. This refers once again to telemedicine and digital health solutions, as well as the supply chain innovations that we see are very popular across the continent. Then when you have a more medium or moderate enabling environment, with potential to be improved, then you can have quick wins with a more supportive enabling environment. These are namely in areas of support systems that we can create for entrepreneurs and innovators, knowledge and awareness building, especially to dispel stigma and discrimination in health conditions. There's also potential for agri-tech solutions to grow and payment solutions. The areas where innovation is lacking and which needs a very strong enabling environment. And from our work, we've seen that this area desperately needs attention. These are more in provision of sanitation and utilities, mobility and home care, provision of nutritious food across the continent, and the management and recycling of waste for medical purposes. So we generated 3 key insights from our findings. Firstly, that cultivating enabling environments from both the public and private sector activates the solutions that you can find for innovations. There are many solutions that are underutilized across barriers. So we know the popularity of digital innovations and supply chain innovations, but the rest need a more supportive environment for innovators and entrepreneurs to succeed. And in everything that you do, health is not in isolation. It's intrinsically linked to social factors and social determinants of health. And this is where you need to bring in equity and a social systems lens as well when considering health innovations across the continent. Our recommendations after this work, firstly, social innovators and entrepreneurs need to have long-term vision, and they need to build that within their business model. So they need to actively work towards that and have a long-term vision of what they anticipate in future. They also need to know that the pathway to success is convoluted. As we saw with COVID-19, entrepreneurs and innovators need to have the ability to adapt, and they also need to see the different touch points and interconnections between different actors, and also have a system lens with intersectionality, looking at gender rights, youth development, education, and social development as well. Social entrepreneurs, a common theme that we found were that many of them were resilient. And no matter what curveballs they were thrown during the pandemic, they somehow managed to just get around them. And we understood that it's not an inherent trait, but rather a muscle that you need to exercise continuously over time to be able to dodge the curveballs and continue doing the work that you're doing at the ground level. And lastly, you need to embrace radical partnerships. I mean, we saw how stakeholders and different actors came together during the pandemic, but you need to think of partnering with people you might not usually partner with, or who are not traditional partners in a sense. And this can go across different contexts, so local, regional, global, national. Cooperation and collective collaboration was something that we noted as well. And yeah, that's it. Thank you, everyone. And I think we can move to questions now. If you can just drop it in the chat, and then Katusha and I will go through them. Thank you.
Or feel free to put your hands up. Oh, thank you. I see we have a question here about what elements were included in measuring the public sector enabling environments.
Thanks for that question. I think it was the scan that the partners did, the impact intelligence partners did, and also the validation workshops. So it was mostly a qualitative experience. So asking people how were their engagements with public sector officials, what barriers did they encounter with them, what are the challenges engaging with them. So yeah, and then that's depending on what feedback we got from them, as well as the AI scan, how much they generated from the different countries. I think that's how we position them on along that spectrum.
Yeah, that's a great overview, Jill. And then obviously we also looked at the formal and informal elements. So the public policies, governance structures, what regulatory frameworks existed, investment environment as well. So those were just a few of the, the elements that went into determining that. And then from Ruth, we have, could you share any examples of particularly successful or impactful innovations you came across?
Oh, so many. There's so many inspiring social entrepreneurs that we spoke to. We know the ones working in the NGOs like North Star Alliance, Broadreach was there as well. Then innovators at the ground level, there's Medicare, which is a health app in Tanzania that's led by one of our Bertha scholars. There's another app here called Vive Teens in South Africa, which looks at depression and mental health among teenagers. Yeah, there's Shona Quip, which is for people with different abilities. That's a social enterprise here in South Africa. There are perinatal mental health organizations and NGOs that we interviewed. Yeah, there's so much work. Katusha, do you remember any that stand out?
Yes, of course. There's Whisper Health from Nigeria, which is a mobile app that provides young people, especially women, with private, even anonymous access to sexual and reproductive health information and health education. So that was a really great one to interact with. And then there was an I'm going to mangle the name now, but there was a wonderful organization in Somalia, the Somalia Innovation Response Team, collaborated with a television station, and they created a comic animated series featuring these two little superheroes that educated children about the COVID pandemic. And, you know, obviously they wanted to allay any fears that they might have in this strange time that was going on around them. And then these little superheroes were able to speak to them in Somali and sort of educate them about what was going on in their home and around them. So those were two that I really, it was called Gika Musku is the name of the animation series. So that was really interesting to hear about.
And I also remember there was My Medicines from Nigeria, and I think the social entrepreneur and innovator there was a fellow of the Bayer Foundation Social Innovation and Health program, right?
Yes.
And a recipient of one of the awards, yeah.
That's right. Ash has a question about were there any innovations or solutions looking at broadening education and training qualifications? For example, how can we expand the number and range of healthcare providers and also include them in designing their own community-based health services? And that this might fall under building knowledge and understanding.
One of them that comes to mind, I think it was the Tabita ambulance. Was it in Ethiopia?
Yes.
So yeah, I mean, they did a lot of first aid training and equipping ambulances for responding to health emergencies in the country. And yeah, there were some other ones as well. I forget the name.
Yes. There were definitely some others, and I think this goes to Ernest's question about, is there a listing of where we can find these amazing innovators and entrepreneurs? And there is a listing within the report itself under each of the sort of examples and sub barriers. We have these innovators pulled out. So that's a great way to find out more deeply about the who we engaged with. Let's see, thank you. All right. Any other questions or comments? And I just want to say Ernest is from Broadreach Healthcare, who contributed to this report. So thank you.
Yeah.
And feel free also to put your hand up or just to chime in. How can we help make sure that this report is disseminated widely? I think from my perspective, and thank you so much for taking up that standard, Ernest, is to share it in your own networks. That would be wonderful. We have our own networks and our own sort of range, but yeah, if you would please go ahead and put it out on your own networks, that would be amazing. Or include it in any newsletters that your own organizations might be sending out. That would be great. Gillian, from your side?
I think as well, getting this report to any public sector or Ministry of Health officials in your countries, yeah, I think that would help them as well, just to take a look and see what we find, because I think these findings may be interesting for them as well. Okay, let's check if there are any other questions. I'm public sector EOP, yes.
Fantastic. Thank you so much. and thank you, Ash, for your kind words. It was a wonderful project to work on, and we really enjoyed it. So I'm glad to hear that everybody else is enjoying it as well. And thank you, Diana, for the updates about how we will be sharing snippets across our social channels.
Yeah.
Great. Well, as we said at the beginning of the chat, Diana did drop the link to the report into the chat. So please take this opportunity to read it a little bit more widely, share. And yes, I think that's a great point, Ernest, just to pick up from that. Is there a plan to repeat such a report every few years? I think that's a wonderful idea. And I would certainly be keen for Bertha to continue engaging with that the network of social innovators and entrepreneurs that we've been able to meet and to start a dialogue with throughout this process. And I think that's a wonderful idea to repeat it. I know that that the Global Alliance is interested in sort of a phase 2 of this, which would be to look at South America. So I don't see any reason why we can't, after that, maybe think about doing a report in Africa again. And then finally from Lisa, we have, do we think South Africans' healthcare systems are geared up for moving towards an NHI or a UHC?
I think considering that we still have many of these challenges, like the barriers over here, I can think of application to the healthcare system, South African healthcare system specifically, where we can see a lot of these barriers. So I think it will still take time. I think it's important to consider the systems lens when we are developing the NHI and universal healthcare. I don't think it's going to be a quick fix. And I think it's going to take a long time to achieve those universal healthcare outcomes that we are looking at. But that is why we keep working towards it. And that's why research like this to see where are we and what else can we do better in future to achieve that. I think that's necessary in future. And I mean, even in future pandemic responses as well. Who knows what the next pandemic would bring and what else it will unearth. So yeah, you, Katusha?
No, I agree with you. I think it's a great question. I think it's really pertinent. I think through all of this, it's important to remember that social innovation is one of the tools or mechanisms towards, moving the health system forward and supporting the health system as we're hopefully moving towards health equity. So it's just one of the ways in which we can help support South Africa's health systems. And Michelle, does the Bertha Centre play a role in enabling radical partnerships? And if so, how?
Yeah, we have all of the people that we interviewed here. We can link you up with them if you see a potential partnership. We are also part of the Social Innovation in Health Initiative, which is a global initiative. And we can connect you with people in other continents and other countries. And yeah, so you can reach out to us and we can see what we can do to assist your radical collaboration.
Thank you for mentioning SciHi, Jill. That is a wonderful initiative that is across the global south. We have a hub here at the Bertha Centre, but we also have hubs in Malawi, in Nigeria, in Ghana, in Rwanda. We have hubs in India, the Philippines, in Vietnam, in Latin America. We have a hub in Guatemala and in Colombia. These are all hubs at public sector institutions, universities of and faculties of medicine or public health. And it's a wonderful way in which we can contribute to the research in social innovation and health, especially in the Global South, but also in how we can work together and how we can learn from one another. So that's a wonderful organization that we have contributed to, and which we continue to gain a great deal of benefit and support from. Wonderful. Thank you, everybody. We've had some great questions.
Yeah.
It's very much appreciated.
Thanks, everyone. Iviwa, Diana, any closing?
Actually, I just want to thank everyone for attending, and also just to mention, like, a wrap-up email will be sent out to everyone. That will include this recording and the presentation, and some added resources if there are any to be added. So if you can just look out for that, we'll send that to you next week.
Okay, thanks,
Thank
everybody.
you. And just before we leave, do we have a date for our next brown bag?
The next one will possibly be, just give me 1 second. It will probably be in the next quarter though.
Thank you.
So if you would like to find out more, please just let us know, and then we'll include you in our mailer sending out.
Wonderful. And please feel free to reach out to either myself or Jill if you'd like to chat about the report more, or if you'd just like to know more about the work that we're doing in the health systems innovation portfolio. Thank you very